Okay. So let's start discussing the first case. We have a patient that consults a gastroenterologist for the first time. When they first meet, the doctor asks for his referral from the primary care physician. He is required to co-pay for the consult as the physician is out of network. What insurance plan does the patient have? He has a PPO, he has an HMO, he has a point of service, or he has a Medicare. Please I would encourage that all the participants to the course vote to have a better perspective. Okay. So there are 2 C answers and 1 B. Very interesting. We will discuss the answer immediately after the next clinical vignette. Another patient comes to this hospital complaining of a persistent headache. He requires no referral from a primary care physician for accessing this hospital's services. What is his insurance plan? Exclusive medical organization, HMO, PPO, or Medicare? Please vote your answer. We will finish the poll in 1 minute, so please let me know your probable answer. Okay, so once again we have 2 C's. No, this time we have the same answers. We have 2 C's and 1 B's. Now let's discuss the correct answers. We will go firstly to the first clinical vignette. The correct answer is point of service. There are 2 services, or actually 2 insurances, that can have physicians that are out of network. Both of them require a copay. These insurances are either point of service or preferred provider organization. The difference between these 2 types of insurances is the fact that the point of service requires a referral from the primary care physician. In contrast, the preferred provider organization does not require any referral from the primary care physician. Therefore, the answer to this clinical vignette is C. The second vignette has as correct answer an exclusive medical organization. There are 2 insurances that have an in-network treatment, namely a health maintenance organization or an exclusive medical organization. The difference, once again, between these 2 insurances is that one requires referral, namely a health maintenance organization. The other one, exclusive medical organization, does not require a referral from the primary care physician. Both of them work only for in-network specialists. Okay, before going further, are there any questions on this on these clinical vignettes. Also, if there are new people joining in, please let me know your name in the chat box. Why not C in the last question? A PPO. Because if we read the clinical vignette, it states that he has this hospital, his hospital. Therefore, it is not an out of network service. Hi Carlos, pleased to meet you. Okay, Dr. Deepak, do you find it Dr. Deepak, did you understand why it's not C? Okay, now could you tell me what are the insurance plans that require referral from a primary care physician? Then also in the chat box mention what are the insurance plans that have high copays and deductibles. And lastly, could you tell me which insurance plans restrict the patient in the specialists they see? Our number have increased, so please let me know your name in the chat box. So Carlos, indeed you're right. For insurance plans that require referral from a primary care physician, we have point of care and health maintenance service. Also, Dr. Deepak, you are right. PPO as well as point of care are two insurance plans that require copays and deductibles. Now, for the last question, which insurance plans restrict the patient in the specialists they see? What answer do you think is appropriate? So Carlos says that health maintenance services indeed restrict the patient to the specialists in network. Accountable care organizations, once again, they restrict it because they are through Medicare, but it is also the exclusive medical organization that restricts the patients to an in-network specialist. Okay, let's do a little bit of recap. So, you can screenshot this slide as it gives you all the information you need to know on insurance plans. For the case of an exclusive provider organization, we do not need any referral from primary care physicians. However, it restricts to specialists that are in the network. For an HMO, which is the most affordable health insurance plan, we need a referral from the primary care physician, and it also restricts to the specialists that are in the network. In the case of point of service, there is a need for a referral from the primary care physician. There are high copays and deductibles, but one can access specialists out of network. In the case of preferred provider organization, we do not need a referral from the primary care physician. However, we have copays and deductibles. Lastly, a patient can see out-of-network specialists. In the case of Medicare, we have a restriction to specialists that are part of the Medicare program. However, we do not need a referral from the primary care physician, or we do not have any high copays or deductibles. Do you have any questions on the insurance plan theory? Please let me know, because I saw that the numbers oscillate. If you are a newcomer, also let me know your name. Okay, Dr. Deepak, I took note of what you said. If you are part of the weekly newsletter, the next weekly newsletter will have this table as part of the newsletter. Okay, let's go to the next clinical vignette. We have a 17-year-old patient that comes by herself to the gynecologist complaining of amenorrhea for the last 9 weeks. An in-office pregnancy test becomes positive. The transvaginal ultrasound shows a crown rump length consistent with a 9-week pregnancy. The patient states that she wants to have an abortion as she is preparing for college. What is the best next step? Schedule the patient for an upcoming abortion, discuss the patient's options, search for the consent of the parents, or advise for medical rather than surgical abortion. Please vote your answer. Okay, so please let me know your vote. Okay, so the answer given by you is B. Would you please expand on why do you think B is the answer? Carlos says that he wants to explain the medical or surgical option. Okay. Okay. Firstly, it is highly important to point out the fact that the patient is 17-year-old. Therefore, he's minor. The correct answer is C. Search for the consent of the parents. Now, there are 3 cases in which we do not need the consent for minors. In the case of sex, STDs, prenatal care without abortion, and contraception. In the case of an emergency, usually on the USMLE you will have a child of a Jehovah's Witness in an emergency situation, but you can treat the child because there is a life-threatening condition. And the third case, when minors do not require consent from their caretakers, is substance abuse. However, the medical abortion is the exception from the consent rule that states that minors do not require consent for sex emergency cases and substance abuse. Okay, are there any questions on this? Carlos, could you expand more on the question? Yes, so the idea is that any case of abortion requires consent or at least informing. Also, to answer Dr. Deepak's question, on USMLE this question might appear, but there are two ways of appearance. Firstly, we can talk about informing the parents in some states. In other states, the consent is required. To summarize, the variation based on state is represented by either informing the parents or giving consent by the parents for the abortion. Okay, our number already increased, so please let me know your name in the chat box so we can have an interactive session. Last clinical vignette. We have a 16-year-old boy that comes to the emergency room with pain that started periumbilically, but now it is in the right lower quadrant. A CT scan shows inflammation of the appendix with labs revealing a high ESR. The patient's condition is not life-threatening. He states that he wants to sign for the operation stat. Which one of these categories might the patient be able to opt for the surgery? Patient with STD, immigrant, military recruit, or orphan child? Please let me know your answer by voting in the poll. Okay, we will close the poll in 30 seconds, so please let me know your vote. Okay, so indeed the answer is C, a military recruit. There are 3 categories of legally emancipated minors that can take decisions for themselves, actually that they can make decisions for themselves. The married minors, the military recruits, and the self-supporting minors. Please let me know any questions you have up until now. Okay, then for a short intermezzo, you can support the channel on Patreon. You have the link in the description. All the revenue will go back into improving the quality of the live streams, as well as improving the quality of the educational videos. Dr. Deepak said that he wants to be part of the newsletter, so if you want to receive summary sheets for USMLE and for your clinical rotations, send an email at medicalperspectiveblog@gmail.com. Please let me know when you are ready for the second half of the course. Okay, let's pursue to the next question. A patient's medical services receipt comes home. He notices that for each service the gastroenterologist provided, there is a discounted fee. Which payment model was used in this case? A bundled payment, a fee for service, a discounted fee for service, a capitation, or a global payment? Please vote your answer. Okay, so we have an A and a C. Let's go to the next question before discussing the results. A primary care physician receives a patient for the 5th time this month. She is overly anxious of not developing pancreatitis as her brother developed. When the primary care physician demands the insurance company the payment for the ultrasound he made to the lady, the insurance company responds that regardless of how many visits or services he provided, the paid sum remains the same. Which payment model is this? Bundled payment, fee for service, discounted fee for service, capitation, or global payment? Please vote your answer. Okay, so the answer is in majority A. Now let's see the answers. The answers are C, respectively D. Let's discuss them a bit. So in this case, service that the gastroenterologist provided, there was a discounted fee. Therefore, this is a discounted fee for service. If the patient did not have a discount, then it would another case is with the primary care physician. Here we have a primary care physician that receives a fixed amount of payment per period for taking care for taking care for the lady. Therefore, he's not fixed on his services, he's fixed on his time period, as in the first statement. The primary care physician receives a patient for the 5th time this month. Therefore, the answer is capitation. Do you have any questions on these two questions? Okay, Dr. Deepak, I understood. This problem of connection will be mended on the next live stream. Okay, so if there are no questions, I'm going to recap a bit the payment models. A bundle payment means that for each service, the insurance usually buy HMOs for primary care physicians. Primary care physicians receive a certain amount of used by PPOs. In the case of fee for service, the patient or insurance company pays for each service with its entire price. Lastly, there is the global payment model, in which the insurer or patient pay for all expenses associated with an incident in a single payment. The most frequently case of global payments are surgeries.